Hey guys, it's Dr. Kurtz again, and we're going to be doing another dinner with a doc, which is exciting. And so tonight we're kind of kicking off our new series, which I'm really excited about. We're going to be talking about regenerative therapies. And so kind of what that is just, what's kind of up and coming, kind of things that have come out that are new, and kind of alternative things that we can do for treating our horses and keeping them in prime athletic condition. So tonight's topic is going to be about IRAP, which stands for interleukin-1 receptor antagonist protein. So you'll probably only hear me say out that whole term once tonight because that's a long one, but it's pretty commonly known as IRAP. And what IRAP is that we use it for joints. And so we take it, we draw blood from your horse, we process it, and then we inject it back in the joints like a typical joint injection. And so where we use it a lot is for degenerative joint disease. So kind of before we get into the stuff about IRAP, I was going to talk a little bit about degenerative joint disease, or DJD. Which is kind of just the fancy term for osteoarthritis, or commonly known as arthritis. And so I think most people know what arthritis is, but a lot of people haven't heard of DJD. And so degenerative joint disease is more of a cycle, and kind of towards the end of the cycle of DJD, we get to have arthritis. So when we think of arthritis, that's kind of the end stages of degenerative joint disease. And so basically degenerative joint disease, the hallmark sign of it is inflammation. And so I think a lot of times when we think about inflammation, we have a really bad connotation with it, that I think most people know that inflammation isn't good. But the truth is inflammation actually is really important. It's part of your body's normal defense mechanisms for infection and injury and those sorts of things. And the problem that we run into, so when degenerative joint disease starts, it starts for just because of something like joint discomfort, pain, or stiffness. And so it's a normal response to that discomfort. But the problem that we run into is if inflammation stays there too long, or it doesn't break down, then it just leads to more inflammation. And so that's where with degenerative joint disease, so it starts an inflammatory cascade. And so basically what happens is your horse, and it's not necessarily even something clinical, like it's not like that they're necessarily lame or the joint swollen or something like that, but they just have some sort of discomfort or pain in that joint. And what happens is that you have these little messengers called cytokines that float around in your bloodstream. And what cytokines, they're proteins, and what they do is they float around your bloodstream and they go to different sites and they try to find inflammation. And so what happens is if they get released, they go to that area and then they recognize there's a problem, so they send out messages that we need to increase the blood supply to that area. That's called vascularity. So that's what happens. So the cytokines float there, they recognize there's a problem, they send out the message that they need more blood supply. So when more blood supply comes in, that brings all these inflammatory mediators. And so there's hundreds and hundreds of these little messengers or cytokines that come in with inflammation. And so what happens is if you kind of, like I said, you don't necessarily see this clinically, it's more on a cellular level. So what happens is cytokines are out, it's causing an immune response, it's causing inflammation. Well, if you kind of think of it like you have a controlled area, that's not growing and expanding. So as more of that inflammation gets there, it kind of crowds that joint or that area. And so it can make it hard for, repairs to happen. And that's where you start to see some disruption in, joint surfaces or cartilage, or you might see more mineral deposits from, the bone kind of readjusting and changing. And so basically we kind of think of that as just poor repair. And so what happens is a lot of time, it's not that your horse is three-legged lame. They're still able to move and work and stuff like that. So as they keep moving and working and they have continued use of that joint, what happens is it causes more stress. So more stress more cytokines, more damage, and it kind of starts that big cascade. And it causes kind of that a massive inflammatory response. And like I said, it's very frustrating with the degenerative joint disease and the inflammatory cascade, because a lot of times this is insidious and we don't see it. And so usually by the time the horse is lame, or by the time your horse flexes positive on a lameness exam, you're kind of at the end stages where you have bony changes or arthritis. And so that's where it can be a frustrating one to be able to recognize early, just because they are, it's kind of closed in on a cellular level. And so I think most people kind of know, for arthritis and for joint disease, it's pretty common to do joint injections. And kind of in the past, the big thing that we would use were steroids in those joint injections. You pair it with an antibiotic, a lot of times something that improves the cartilage and the joint fluid. And steroids work amazing for inflammation. They're really good at controlling inflammation. The problem for steroids with something like joint disease is it's kind of just a Band-Aid. And so what it does is it works great when you give the first, joint injection with a steroid. You really control the inflammation. The horse does great. And so the problem with steroids is over time, their effects are less and less. And so it's pretty typical for you to hear that, over time that, horse started out getting hawk injections with steroids every year, and then it's every, they didn't last a whole year, now they're only 8 months, and then, okay, now they're only 6 months. And so that's where, with steroids, you see less and less of a result from your joint injections. And we also know that steroids, and some steroids are more, have more effects than others, but they do slow cartilage production, which long-term is not ideal. And then the other thing is you do tend to have more side effects from steroids. So we do worry about with steroids, some horses not handling them well and having something like laminitis or flare-ups from those steroids. And so we have to be pretty cautious in how we use them. Usually we have a total dose that we don't go over for horses. And so for a lot of times, like, if we go out to inject multiple joints, so hocks, stifles, coffins, that we kind of have to plan which joints we're going to inject, just because we don't want to go over that dosage with the steroids. And so that's where IRAP kind of comes on to, it's been kind of a new, on the new horizon kind of thing. And so, like I said, it's called interleukin-1 receptor antagonist protein. And so basically, from lots of research, scientists know that one of the most important cytokines that we have with joint disease is IL-1, and it's interleukin-1, but IL-1, and so that one's very important to starting that inflammatory cascade. And so with the IRAP, they have that antagonist protein part of it, which is just a fancy word for a protein. It goes in there and it binds to those IL-1 receptors. And so basically when it binds there, the cytokine that's released, it can't attach there. So if it can't attach, then it can't complete that message of bring more blood supply here, bring more cytokines here, let's increase the inflammation in this area kind of thing. So it basically stops the inflammatory cascade. So it's pretty cool because, with this, antagonist protein, it's an anti-inflammatory mediator. And basically what that means is because it stopped that message from sending, then your body doesn't send in a lot of that inflammation. And it actually has a little bit of a regenerative response as well. So clinically what that means is that we see an improvement in lameness. We see an improvement in, range of motion. And these horses, it's really cool to see their joint fluid, when we go back and check them after doing, IRAP, like, we're coming back the next year to do IRAP again, because it really improves the quality of joint fluid. It makes it more viscous and thicker joint fluid. A lot of times, like if they have really thin or bloody joint fluid, the year before it resolves and it gets a lot better. So the big question I get is, how do we get IRAP? And it's actually a pretty cool process. So we do a farm call, and we go out to your horse, and it's a pretty easy procedure. We just draw blood, and we use a specialized syringe for that. And so after we do that, it's a sterile procedure because we are going to be injecting it back into the joint. So after we do that, we take it back to the office and we actually incubate it for 24 hours. And so after it's incubated for 24 hours, what I then do is then I process it. And so basically we spin the blood in the centrifuge, and then we have to put it through all these filters because we want the serum from that syringe. We don't want any of the red blood cells or blood in that syringe. And so the other really cool thing about IRAP is after you process it, it takes 24 hours turnaround time, but after we process it, we can also just freeze it and store it. And so we can store it for, up to a year. And then whenever we're ready to go use it, we go ahead and defrost it. And then we go ahead and use it. Because you are using the horse's own blood, and each individual horse is different, usually we have a little bit of a range of how much, IRAP we have produced from a horse. And so I would say typically with when we draw the blood syringe of IRAP, we actually can use it in, multiple joints. So that's, typically depending on how big the joint is, that we can use it up to, 8 joints, 10 joints, that sort of thing. And so when we go to inject it, from then on out, it's like a normal joint injection. So we, scrub the joint, we sedate the horse, give them a pain medicine, and then what we do is we give the IRAP, and we actually mix it with polyglycan, and then a little bit of an antibiotic because you always worry about infection with joint injections. And like any other joint injection, we give the horse some time off. We give them 4 to 7 days off, and then start light work. And on that time, they're usually on a pain medicine. And so that's the cool thing about IRAP, that, you can use it, spread out how much you use it. You can use it multiple times. So say if you want to inject hocks, that we can inject hocks twice a year, and that sort of thing. And the other big question I get is, who is the best candidate for IRAP? And so for IRAP, it's usually those horses that are in that degenerative joint disease kind of cycle. It doesn't work. We don't see nearly as good a result for horses that have really severe arthritis where they fuse the joint. Those horses don't usually do as well with it. But for those horses that have very mild arthritis, or they haven't even really developed arthritis yet, they're just starting to get some joint pain and joint discomfort, not performing as well as they, usually do. Maybe that they flex positive when we, do our lameness exam. Those horses really benefit from the IRAP. And the cool thing about it is that, it's not just a Band-Aid. We're actually working to kind of, stop that inflammation cascade in the joint. So anyway, so it's a pretty short talk tonight. But, as always, if you have any questions, you can message us, or give our office a call. And then, if you want to schedule, IRAP to be done on your horse, of course, just give us a call. The other thing is that you can find this blog post, on our webpage and, read more about it. And as always, if you need any information, just let me know. And thanks for joining me, and have a good night.